Dr. Khan, how do you know if your muscle is able to be repaired?
So a lot is dependent on your previous initial surgeon who did the augmentation, how she or how he or she was proficient in regards to putting in the implants. Now, if the muscle was cut, which is the pectoralis major at its origin at the bottom, no matter what, the muscle cannot be quote reattached at the origin and suture. Very similar to, say, for example, the Achilles tendon. If you cut it, God forbid, with a knife or a trauma, and then 3 months later you go do about the surgery, the muscle already has retracted up. You cannot just pull it down and suture it back to its origin. Likewise, once the muscle is cut, it retracts, and then not only the muscle retracts, but because the muscle is not truly used, because it atrophies, if you start working out gently, for example, you're going to compress the implant against the rib. That's going to be an awkward feeling. So the ladies truly cannot work out. That's why the bodybuilders get their implants above the muscle, because the muscle is not cut. If I take a Olympian, for example, a triathlete, and I cut one of his muscles, all of a sudden his function of the body, the muscle is gone. And so the young patients and the old, whoever gets the augmentation and where the pectoralis major is cut, because the surgeon wanted to put 500 cc implant underneath the muscle, which truly cannot fit in majority of the cases with the normal BMI. The muscle cannot be years later moved down back to its origin and anchored into where it was at the origin. Now, there was a case I did a couple weeks ago where this nice patient from Hawaii, her surgeon was very smart and very technically proficient, where he put in a large implant because the patient was large, but large enough such that he did not have to cut the muscle. And in that case, I never cut the muscle, and the muscle was intact and preserved, and the surgeon did a very good job, and I did not have to deal with the cut muscle. So bravo to that surgeon who did it optimally and correctly. So hopefully that answers the question.